My name is Dr. Nanette Wendel, and I'm a board-certified surgeon, and I am the medical director of the St. Luke's Women's Center. I went to medical school at Northwestern University Medical School, and then I did my training at Northwestern University Medical School and also at the University of Nebraska Medical School, where I was chief resident. During my medical school years and my training, I noticed that there weren't very many women physicians, let alone surgeons. So I was automatically drawn to surgery anyway because of my personality, and decided as a woman that I might be best suited to treat women's health issues, etc. So then naturally was drawn to breast surgery. I truly believe that in empowering the patient to be an active participant in their health care and their health choices. Therefore, I feel that my role is not only to be the surgeon and to operate on them, but to give them the most amount of information I possibly can, and also guidance. While I perform all aspects of breast cancer surgery, I feel that one area where I have excelled is in wire-free technology for lumpectomies and excisional biopsies. And I find it's much nicer for the patient. It's much less stressful than having wires and things sticking out of your body as you're roaming around the hospital from department to department. So that has been a huge transformation, I feel, in breast surgery in the past few years. Most people know that my passions are travel and photography. Recently, in the past several years, I've become more interested in sled dog racing. And most people, again, who know me well know that in February you will not find me in St. Louis. You will find me in the Yukon Territory of Northern Canada or Alaska, helping out with long-distance sled dog races. And of course, I'm also taking photographs during that time, which it's become a big passion of mine, is the sled dogs. I truly believe that at St. Luke's we're very unique in that we truly do treat everyone as an individual. Generally, there are no symptoms. The vast majority of breast cancers are found on mammogram. Therefore, we have to really hit hard the fact that patients should have a mammogram on a yearly basis. But some of the other signs and symptoms that one should look out for are a breast lump, bloody nipple discharge, and changes of the skin, especially the nipple area. Any of those things should prompt an appointment first with either your primary care or OBGYN, and then referred to a breast surgeon. There are several risk factors. One is the age of your first period, the age of your first born child, the age of menopause, various other things. The vast majority of people think that family history is the biggest risk, when in fact, only 15% of breast cancers run in families. The other 85% do not. So while it is a risk factor, it is only one of the risk factors. There are a few things that have been proven. One is no smoking. Another is limited to no alcohol, and I say limited because no alcohol is not realistic. Exercising 30 minutes a day, 6 days a week, can be as simple as walking. And we recommend a plant-based diet. And again, that does not mean no meat, but something like a Mediterranean type diet. All of those things have been proven to decrease your risk. The vast majority of the breast cancers are diagnosed on mammogram. That is the first screening method. If there are abnormalities on mammogram, then more imaging will be needed and performed. And then the vast majority, about 99%, are diagnosed with a needle or core biopsy in this day and age. The treatment of breast cancer is a multidisciplinary approach, again, between medical oncology, surgery, radiation oncology. And the vast majority of the time, though, the first course of treatment is surgery. There are some instances where, say, chemotherapy would be the first course of treatment, but I'd say 90% plus the first course of treatment is surgery. For more information, please visit the St. Luke's Women's Center website or call 314-205-6491.